Hi doctors, welcome to Holistic Professional Success. And today you're going to learn how to help your patients heal twice as fast. Welcome, I'm Doug Grant, and we're going to be talking about how to help your patients heal twice as fast as normal. And I know that's crazy, but there's some phenomenal research out there on holistic treatments that prove you can help your patients truly heal faster and do it without the side effects of drugs. Today we're going to kind of keep this short and sweet and focus on one study, one bit of information so you can kind of see the concept, and then through additional podcasts and videos, we're going to go through some of the other research studies, different nutrients, different treatments that have objective proof that you can actually help your patients heal at least twice as fast. So let's get into it. Let's go to the number one topic here. What's the main reason people come to your clinics in the first place? What's the number one? Pain. That's right. They have pain, whether it's low back pain, neck pain, muscle pain, pain of their spouse, whatever it might be, they come in for pain. But let's look at the main cause of pain. And the main cause of pain is some type of either injury that's caused from an external force or internal injury due to wear and tear or toxic effects in the body. So since pain is the main reason that people come to your clinic, then it makes sense that the most prescribed drugs out there, or ones that people go and buy over the counter, are ones just for pain relief, muscle relief, or inflammation reduction. And so in the industry, we call them NSAIDs, right? Non-steroidal anti-inflammatory drugs. But the problem with these things, the ibuprofens, the naproxens, all these different things that are out there, is they have terrible side effects. Let's look at this research or this statement from the FDA. It shows that non-steroidal anti-inflammatory drugs, or NSAIDs, are the most frequently used group of pharmaceutical compounds. Okay, so the most frequently used, and this came straight from JAMA, so we know this comes from their statement of doing the research and looking at what the most frequent group of pharmaceutical compounds is. And then here's what we know. We know, check this out, that the FDA just updated its warnings for prescription and over-the-counter non-steroidal anti-inflammatory drugs, so the aspirins, those types of things, to say they increase the chance of heart attack or stroke. Now, how great is this risk? It's like, okay, well, is it a 1% chance you're going to get it? No, there is no period of use shown to be without risk, said Dr. Judy Ruckusen, the deputy director of the FDA. All NSAID studies were linked to a 2 to 4-fold increased risk of gastrointestinal complications. So 2 to 400% increased risk. So we know that this is a huge problem. The NSAIDs themselves, the things that most people take for pain, are actually increasing risk of heart attack, increase of stroke, increase of gastrointestinal complications, bleeding in the stomach, ulcers, those types of things. So this is a huge problem that we've got to understand. Now, for you holistic professionals, there's something that I want you to think about for a second. And here's my question to you. Are you recommending something to your patient as an alternative for NSAIDs? Think about it for a minute. Because if you're not, you're part of the problem. I know that's harsh, but people are going to take something to get out of pain. And if they're already coming to you, they're wanting an answer. They're wanting an alternative. And if you're not giving them the alternative, then they're going to go back and keep using the NSAIDs. So we're part of the problem. You with me? So pain sufferers account for more problems than all the other diseases combined. Chronic pain, 100 million Americans. Diabetes, 25.8 million Americans. Coronary heart disease, 16.3. Cancer, 11.9. So chronic pain is the biggest problem out there today and account for more problems than all the other diseases combined. That's a serious situation. So pain's a major problem. Your patients come in with the pain. We know NSAIDs cause disease. So what are you doing about it? What are you recommending? Let's look. There's something you can do and some great research to go back to the 2 times increased healing time for your patient. So in order to understand the nutrients that help with pain, let's go to the basic chemistries and the foundation anatomically of what's going on. There are specific chemical inflammatory mediators that are produced at the injury site. So if we have an injury, say to a muscle, and they're called prostaglandins, we know this. And the white blood cells secrete additional mediators. That's why our white blood cell count will increase. So that's all good and fine. And here's a picture of actual damage in a muscle right after, this was an ankle injury and to a hockey player. And so we have all of this damage that's in there. And then over time, it starts to heal, and the body comes in with these mediators, the prostaglandins, the white blood cells, and help clear out the debris. And then the body starts healing until eventually it completely heals. Now, there's a study that shows the long-term use of NSAIDs problems with intestinal damage, and it's very interesting that it showed that people that use the NSAIDs, the aspirins and that, have an increased risk of bleeding and visible damage to their intestine. They're actually able to go in and see the damage that's caused long-term. So people have been taking ibuprofen or these things long-term. The longer they take them, the more damage that's caused. We know it's a huge problem. So what we want to do is to speed up the healing time and help people get out of pain. Now, the speed at which inflammation occurs is resolved by these things we talked about a minute ago that was proven by Wolf back in 1986 called prostaglandins. And these prostaglandins, there's good and there's bad. And I know that we can get into the details of that, PGE1, PGE2, but for the patients, good, bad prostaglandins. The good prostaglandins decrease the transmission of pain and inhibit inflammation. And the bad overwhelms and no healing can take place until they're balanced. And so what we want to do is we want to make sure the body gets back to balance as soon as possible. And the problem with NSAIDs is that they actually keep the imbalance longer. So they'll come in and block one of the prostaglandins so that inflammation can come down, and that can relieve pain, right? So if we have inflammation against a nerve and we relieve the inflammation, then guess what? Pain goes away. But they don't balance the prostaglandins for healing. So here's a study that was done, University of Toronto, a phenomenal study, Dr. Fisher, Trent Hart, and the group, and they were able to show that with swelling, so when we have swelling, if you take NSAIDs, then you get a reduction in swelling. We know that based on the prostaglandins. But here's what's interesting is when they gave the athletes, they gave them proteolytic enzymes, the enzyme blend that's in like optimal acute or some other enzyme formula that has proteolytic enzymes like protease and peptidase and those types of things. They're able to reduce the inflammation at the same rate as the group that took the NSAIDs. So we know for surety that we can help reduce inflammation through natural means, through enzymes, proteolytic enzymes, proteases, peptidases. Some of you might have used some enzymes in the past like bromelain or papain. Those are great, although the new proteases and peptidases are much more powerful, but those types of enzymes. So there's no need now to have ibuprofens and those based on the research study to be able to reduce inflammation and help pain that way. But here's what's interesting, and this is a very important graph I want you to look at. That when they did the research on healing time, on true healing time, the group that didn't take any NSAIDs, in other words, they had the injury and they didn't take anything, they actually healed faster than the group that took the NSAIDs. Why? Because naturally the body balanced the prostaglandins faster than when we send in the NSAIDs and the prostaglandins don't balance. That it only blocked the one that helped with inflammation reduction. And so it actually took longer to truly heal. Remember the slides that showed the muscle healing over time? It took longer. So actually you don't heal as fast when you take NSAIDs. You help get out of pain immediately, reduce inflammation, but you can do that with the proteolytic enzymes based on the research. But take a look at the proteolytic enzymes, the optimal acute formula, and the reduction in healing time. So we know that we can heal, look at that, 30 compared to 90. We can heal 3 times faster, true healing, and reduce inflammation the same with natural nutrients. So why in the world, doctors, are you not recommending natural proteolytic enzymes to your patients instead of NSAIDs? So as a replacement for, it helps them get out of pain, reduce inflammation just as fast, but has them heal faster. That's why we do that with all the athletes. And how about ease of use? We use something called a joint pack where we combine the glucosamines and chondroitins for actual healing of the tissue as far as joint tissue, along with the acute, or you take the acute. And again, you can use other companies' formulas as long as you have the proteases, the peptidases, and those things. This is just the one used in that study. And so it's important to communicate with the patient. What will they do consistently? We made these for our athletes because they wouldn't take the proteolytic enzymes consistently with a bottle, so we put them in little packs. They can put them in their pocket. Told them to take it every 3 hours. They could just pull the packet out and take them. So we have to have that patient communication to see what they will do to be consistent. We know for a fact that we can help your patient heal twice as fast. Okay, and so doctors, to be truly successful as a holistic practitioner, we have to give alternatives and proof to those alternatives so that your patients feel that confidence and it actually works. So decide now that you're going to tell your patients of the damage of NSAIDs. Decide now that you're going to confidently show them that research and the statistics, and then show them that there is an alternative and give them the alternative. Give them the alternative so they can heal faster, build that confidence in you that creates a legendary doctor, that brings that branding to you. So now that people will come from all over because they heard that you can help them naturally. And as you do that, you'll be able to have holistic professional success. Have a great day.